If you take vitamin D with your morning coffee, stop. If you take it without food, stop. If you take it alone without these two minerals, you're wasting your money. Worse, you might be creating a problem that won't show up until it's too late. I'm Dr. Kenzo Arasato. 4 decades of practice taught me one thing. It's not what you take, it's how you take it. In my clinic in Tokyo and now here in America, I see the same pattern. Patients with perfect vitamin D levels on paper, but their bodies tell a different story. Brittle bones, constant fatigue, brain fog that won't lift. The vitamin isn't broken. The method is. Today I'll show you 3 mistakes that turn this sunshine vitamin into a silent problem. But first, let me tell you about a patient who changed how I teach this. Robert, 58 years old, came to me exhausted every single day. His doctor checked his vitamin D. The number said 35 nanograms per milliliter. Technically normal. So his doctor said, keep taking your supplement, you're fine. But Robert wasn't fine. His bone density scan showed early osteopenia. His calcium levels were rising, but going to the wrong places. I asked him one question. When do you take your vitamin D? He said every morning on an empty stomach with water. And there it was. Mistake number 1. Vitamin D is fat-soluble. Your body cannot absorb it without dietary fat. Taking it on an empty stomach means most of it passes through unused. In Japan, we have a saying, feeding a plant without soil. The nutrient is there, but it has nowhere to go. Studies show absorption can drop by 60 to 70% without fat. So what did I tell Robert? Take your vitamin D with your largest meal of the day, preferably one that contains healthy fats. Eggs, salmon, avocado, olive oil, not coffee, not toast, not a protein shake. Real food with real fat. Within 4 weeks, Robert felt different. Within 3 months, his bone scan improved. But here's what most people miss, and this is critical. Vitamin D doesn't work alone. It needs 2 partners, magnesium and vitamin K2. Without them, you create a dangerous imbalance. This is mistake number 2, and it's the one that scares me most. Let me explain what happens inside your body when you take vitamin D alone. Vitamin D tells your intestines to absorb more calcium from food. Good, but where does that calcium go? That's where K2 comes in. K2 is like a traffic director. It sends calcium to your bones and teeth. Without K2, calcium ends up in soft tissues, your arteries, your kidneys. This is called the calcium paradox. Strong supplement numbers, but weak bones and stiff arteries. I've seen patients with vitamin D levels of 60 develop arterial calcification. Their doctors were proud of those numbers. I was concerned. Now, magnesium. This mineral activates vitamin D in your liver and kidneys. Without enough magnesium, your body cannot convert D into its active form. You can take 10,000 IU and still be functionally deficient. 70% of Americans are low in magnesium. Most don't know it. The symptoms? Muscle cramps, poor sleep, anxiety, heart palpitations. When I add magnesium to a patient's vitamin D protocol, everything changes. Sleep improves. Energy returns. The D finally works. So here's my protocol, and I want you to write this down. Vitamin D, 3, 4,000 to 5,000 IU daily with food. Vitamin K2 as MK7, 100 to 200 micrograms. Magnesium glycinate or threonate, 300 to 400 milligrams. Take them together with your dinner, not separately. This combination has changed outcomes for hundreds of my patients. But there's one more mistake, and this one surprises everyone. It's about timing, and it connects to something called your circadian rhythm. Your body expects vitamin D during daylight hours, not at night. When you take it late, especially after 7 p.m., it can interfere with melatonin. Melatonin is your sleep hormone. Vitamin D at night suppresses it. This is why some people take vitamin D and suddenly can't sleep well. They blame stress or age. But it's the timing. My recommendation: take vitamin D with lunch or early dinner before 6 p.m. This aligns with how sunlight would naturally raise your levels during the day. Your body recognizes the pattern, and melatonin production stays normal at night. One patient told me she slept better within 3 days of this simple change. No new medication, just respect for natural rhythms. In part 2, I'll show you the exact blood tests you need, and the one number your doctor probably isn't checking that matters most. Welcome back. Let's talk about the tests your doctor should order. Most doctors check only total vitamin D. The 25-hydroxy-D test. This tells you your storage level, but not if your body is actually using it. I also check the active form. 1.25 dihydroxy vitamin D. This shows conversion. If storage is high, but active is low, you need magnesium. I check parathyroid hormone, PTH. When vitamin D is truly low, PTH rises. High PTH with low D means your bones are releasing calcium to compensate. Not good for long-term bone health, especially after 50. I check serum calcium and ionized calcium. Remember the calcium paradox? If calcium is rising, but bones aren't stronger, you need K2 urgently. I check magnesium, not the standard serum test. Red blood cell magnesium. Serum magnesium can look normal while your cells are starving. RBC magnesium tells the real story. Most labs can do this. What are the ideal numbers? Write these down. Total vitamin D. I aim for 50 to 70 nanograms per milliliter. Not 30, not 40. 50 to 70 for optimal bone and immune function. PTH should be in the lower half of normal range. RBC magnesium above 5.0 milligrams per deciliter. Serum calcium stable, not creeping up. That's your K2 safety check. Now let me address something many people ask. What about sunlight? Isn't natural sun better than supplements? Yes and no. After 50, your skin produces 60% less vitamin D from sun exposure. You would need 2 hours of midday sun daily to maintain levels. Most people can't or won't do that. Skin cancer risk is real, so I recommend 15 to 20 minutes of morning sun for mood and rhythm. Then supplement to fill the gap. Best of both worlds. But here's the detail nobody talks about. Seasonal variation. Your vitamin D needs change with latitude and time of year. In summer, with sun exposure, you might need 2,000 IU daily. In winter, especially northern states, you might need 6,000 IU or more. I tell patients to test twice yearly, once in late summer, once in late winter. Adjust your dose based on actual numbers, not guesswork. Let's talk about symptoms of true vitamin D deficiency. Deep bone pain, not muscle soreness. Pain deep inside your bones. Constant fatigue that doesn't improve with sleep. Frequent infections. Your immune system needs vitamin D to function. Depression that feels heavier in winter months. Seasonal mood changes. Slow wound healing. Cuts and bruises that linger for weeks. Hair loss, especially in women over 50. If you have 3 or more of these, get tested immediately. Now the question everyone asks, can you take too much vitamin D? Yes, but it's harder than you think if you follow the rules. Toxicity begins above 150 nanograms per milliliter consistently. Most people taking 5,000 IU daily stay between 40 and 70. The danger comes from megadoses. 20,000 IU daily without monitoring, or taking vitamin D without K2. That's when calcium problems start. Symptoms of excess: nausea, vomiting, extreme thirst, kidney stones. If you experience these while supplementing, stop immediately and test. But with proper dosing and cofactors, This almost never happens. Let me give you a real-world example of how this all works together. Susan, 62 years old, came to me with chronic joint pain. Her vitamin D was 28. Her doctor said borderline normal. Keep taking 1,000 IU. I ran the full panel. Her PTH was elevated. RBC magnesium was low. Her body was pulling calcium from bones because D was insufficient. I started her on 5,000 IU D3 with K2 and magnesium, taken with dinner every single day. 3 months later, her D was 61. PTH normalized. Pain reduced by 70%. She started walking 3 miles daily, something she hadn't done in years. This is what proper vitamin D protocol looks like. Not just raising a number, restoring function. So let me summarize everything. The 3 critical mistakes. Mistake 1, taking vitamin D without fat. Always with a meal containing healthy fats. Mistake 2, taking D alone without magnesium and K2. You need all 3. Mistake 3, taking it at night. Stick to lunch or early dinner. Follow these rules and vitamin D becomes what it should be. A foundation for strong bones, resilient immunity, and steady energy. In my practice, we have a principle. Small changes, sustained, create transformation. You don't need 10 supplements. You need the right ones taken correctly. If this helped you, share it with someone who takes vitamin D. Your body is wise. Give it the tools, and it will heal. Thank you.